I cannot believe we think we could solve the quality and safety and value proposition without having our patients and family members around the table. And to those that say, well, I'm a physician, but I'm also a patient. Yes, you are, but you still come from a different mindset, and you still don't see things the way our patient and families see them. They bring a whole different perspective.
I do think having patients and families involved in improvement work is crucial. It's not just about patient satisfaction scores, it's really about moving the organization's level of professionalism up.
There are always questions that we as clinicians can't answer, things that affect our patients' experience. We are not the experts, but they are. We need to have the patient-family viewpoint at the center of all our decisions. Most organizations do this ad hoc or informally. If you have a PFAC, it helps make it part of your fabric.
And it takes leadership from the board, but I think especially leadership from the executive suite.
Anything you can do to increase performance is going to give you an edge. And I'm here to tell you, patients and family councils can help you do it. You're going to hear things from those members that you're just not going to hear anywhere else. In a way that it was our job to make the healthcare system safe, not theirs. But the truth is we were also afraid of them.
And your biggest fear, of course, is that you'll get people on there that really don't have anything but a bone to pick with the hospital.
We have to kind of dismantle that fear because, like a lot of fear, it's irrational. People actually sue less if you talk to them after a bad outcome. They don't sue more. We're so socialized to think if we're honest, if we tell the truth about something we could have done better, we're going to get nailed for it.
It's a little odd that people wait until they get beaten up in the press because the community hears about a bad event. We have 200 to 400,000 deaths occurring every year from preventable medical harm. If you think that they're occurring at 30% of the hospitals and the other 70% are totally air-free, you're kidding yourself.
You get to redefine, your organization along something that you know is important, patient and family-centered care. But a council just helps you get there fast.
It's hard to imagine not having them involved. I just can't imagine that.
In fact, I think it would be a problem if you didn't have an advisory group because I think you're missing a big part of your community.
Major systems in this country are prioritizing it and putting resources into building PFACQS. So if your hospital hasn't done it yet, you're behind.
Don't be skeptical, just you need to jump in and do this. It's really a great way to receive feedback in terms of the organization in an unbiased way.
CMS, through their HEN network and the Partnership for Patients, is now saying, do you have a PFAC? That is a loaded question. The real question is, why don't you have a PFAC?
I would say you have to try it. You will be amazed.